to another episode of the Afya Health and Lifestyle Interview Series. If you're new here, welcome to the Agbari channel, and if you're a returning subscriber, thank you for stopping by again. At Afya, we'll be inviting well-seasoned health specialists to educate you on certain diseases, debunk some of the myths you must have heard about them, and provide you with actionable tips to prevention and management of diseases. On this episode of the show, we're going to be talking about stroke. And before I go ahead to introduce our guest, I would like to give you a little background information about what stroke is and how widespread it is. Stroke and dementia are the leading neurological causes of death, together accounting for almost 90% of neurological mortality worldwide. Furthermore, stroke accounts for almost 50% of disability adjusted life years lost. In the past 3 decades, lives lost from stroke around the world increased by 50 to 100%, with particularly high increases in low and middle income countries. Having heard all of that, I hope you're taking this more seriously now. And joining us today on the studio is the esteemed Dr. Temitope Lawal. He's going to be educating us on how to avert and manage the stroke. But before I bring him on to the studio, let's get to know him a bit. Dr. Temitope Lawal earned his medical degree from the University of Lagos and proceeded to specialize in internal medicine and neurology at the Lagos University Teaching Hospital. He practiced as a consultant for 3 years in Lagos, then proceeded for neurology residency at the University of Oklahoma, USA. He is currently at the University Hospital Cleveland Medical Center, where he's practicing and further specializing in the movement disorders field of neurology. He is married with 2 children, and his hobbies are swimming, basketball, and chess.
Hi, Kehinde. Thank you for having me.
Thank you for obliging our invite, sir. So before we move on before we get to the main topic, I went through your bio and I'm curious, why neurology and internal medicine? Of all the paths you could have gone into studying MBBS, why did you choose that path? What led you? Why?
That's a very good question. Well, it all started a few years ago when I was in high school. Like secondary school actually, and my late secondary school, and my father was diagnosed with a neurological disease, and that's one of the things that got me quite interested in the field of neurology. And so I read encyclopedias, just tried to understand his disease, and so I decided to go to medical school. He passed on about 11 years ago now, but his legacy lives on in my pursuit of neurology. Now, in the way you specialize in neurology in Nigeria is that you first do about 2 years or so in internal medicine, and then you have to do an exam. And so we typically get a sort of double specialty in internal medicine, and then further, dig into a specific field. And in this case, it was neurology. So that's how I found myself in the most dynamic and innovative field in the entire medical world.
Oh, wow. Okay. It's great to hear that you had, right from the start, you had such clarity. Going into medical school, you already knew what you wanted to focus on, and so you gave it your all and you turned up.
Yeah.
So let's get right to the topic for today. So today we're talking about stroke, the increasing burden of stroke in Africa, in Nigeria. When people hear stroke, I feel like most people they must have heard it somewhere or the other, but they're probably not bothered to check about it or to learn more about it. We just have stroke, oh, this one died of stroke, oh, that one died of stroke. But we don't really have this, it's more of a half-baked knowledge of what it is. So I would like you to shed more light on what it is. What is stroke? What causes stroke?
So that's a very good question. There are a lot of myths, a lot of thoughts about stroke, as you say. And whenever you want to address a problem or you want to fight a problem, the first thing you need to be able to do is to even be able to name the problem, name the disease, and and half of your problem is solved, so that you know if it's curable or not curable, and then you know where you stand. In the case of stroke, I can first tell you that some people think people have so many misconceptions, but let's just give the truth out there, and then let's see what people would do with it. So, stroke is just, in plain words, brain damage that happens when there's a problem with the blood supply to the brain. Okay, now we all have a heart. If you put your hand on the left side of your chest, you will feel your heart beating. If you are slim like you and me, you could actually feel the push on your heart. Now, that heart is the pump that pumps blood all over your body, and the blood contains nutrients. It contains food to all the cells of your body, and it's if there's any blockage or any interruption in the blood supply to any part of your body, that part of your body is sort of like gets strangled. It's like, I'm gonna die. And if it does not get any blood in a few minutes, that part of your body dies. So if you are talking about the heart, if there's a cut in blood supply to the heart strangles, and then that's the part of the heart that gets that blood supply dies. So that's what we call heart attack. Okay?
Oh,
If
yes.
there's a cut off of blood supply to a part of your leg, that part of your leg gets strangled, and then it loses blood, and then it dies off. If you lose blood to supply to a part of your eye, you can get blind. Actually, that's a form of stroke. If you lose blood to any part of your body for a certain amount of time, and there's no attempt to restore the blood supply, that part dies. Same is true for the brain. If there's a damage to the blood supply to the brain, the part of that brain could die. And if it happens to the entire brain dies real quick. Now, in stroke, you lose blood supply. You get brain damage by two basic mechanisms. You have because like I mentioned, let's say this is the pipe that goes and blood passes through to a part of the brain, right? If this is the pipe, there are two things that can happen to this pipe. Okay, let me get within view. The pipe can get blocked. Okay?
Okay. Yes.
If it gets blocked, the blood does not get to the parts of the brain behind that pipe.
Yes.
If the pipe, for some reason, gets a lot of pressure coming from here, and the pipe itself gets overwhelmed, what do you think will happen? It will burst.
Burst. Yes, it's good.
So if the pipe bursts, the blood will spill to all the environment around that part of the pipe. But as it spills, remember that the pressure in the blood will go down behind that point that it spilled. So the blood supply will go down, and the part behind it is likely to die. I also like to use the analogy of having water supply to your house. If the same thing holds true, if there's some sludge or something happens and there's a blockage in the blood supply to your house, if you turn on your tap, what happens? No water. And if there's a car that goes on your pipe, on the pipe that comes to your house, and the pipe bursts, what will happen? Water will spill on the street, and you still will not get water in your tap. So those are the two ways in which the brain gets damaged as a result of blood supply problems to the brain.
Okay.
And you know that the brain is like the central control, it's like the center of control in the entire body. And anything that happens to the brain manifests as problems in the entire body. And so if the part of the brain that controls your speaking gets damaged, you would have you will suddenly not be able to speak well. If the part that
Okay.
supplies your arm, the movement of your arm and legs get damaged, you will not be able to move your arm or your leg.
Okay.
And the same is true for everything you can do in your body. Once there is a damage to the part of the brain that controls it, you lose function of that area. Now, if it damages some certain sensitive parts of the brain, you lose consciousness immediately. Or if the pipe or if the pressure in the brain, when the brain swells from the damage, gets high enough, you lose consciousness, and some people go from there to death. And if there are some certain interventions that can be made on time, some of them can improve over time. I think we'll still talk about that, I believe. So
Yeah.
I think that's a summary of what stroke is.
Okay. Okay. Thank you very much for that. So, if I understand correctly, it's the basic phenomenon is when blood flow to the brain or a part of the brain gets cut off for some reasons, a stroke happens or a stroke occurs.
Yes, through getting cut off or a spillage, but the
Okay.
eventual mechanism is getting cut off.
Okay.
Yeah.
Okay. Thank you very much for that, sir. Thank you for the clarity on that. And moving on, what are there different types of stroke, or is it just stroke is stroke, or
Okay.
what are the types of stroke? Yes.
So in my explanation, I sort of actually explained the types of stroke in my description. I mean,
Okay.
in my definition. There's a dry stroke where the
Mhm.
blood supply is cut off, blocked. Okay, and then there's a wet stroke where the blood supply
Okay.
spills, the pipe bursts, and then spills all over the brain. Now, blood in the brain is supposed to stay in the pipes.
Mhm.
Okay. Now, when the pipe bursts, the blood in the brain, blood spills into the brain, and the brain gets irritated, and it can cause even further complications. Okay.
Yes.
So, in the dry stroke, there's just a simple blockage of blood supply, and the part of the brain behind that point of blockage loses function.
Okay.
In the wet stroke, once blood spills into the parts of the brain that blood should not be in, it starts building up pressure, and it can be quite catastrophic, and it can irritate the brain and cause what we call seizures, and
Okay.
so many other things that can eventually lead to death without quick intervention. So most of the stroke that occurs in everybody, in the population, is like, let's say, about 85 to 90% of the stroke that happens is the dry one, where the blood supply is cut off, and then
Okay.
about 15% or so occur as a result of the bursting of the pipes. Okay,
Okay.
so they can both be catastrophic, but the wet one is usually much more dramatic when it happens to people. And so people tend to seek help real quick, because someone could be talking, having an argument, fighting with his neighbor, and then suddenly he stops talking and then falls down. And then the first thing everybody thinks is, the enemies have come after him and they have struck him, that the
Yes.
person he's arguing with has some form
Sure.
of juju
Better.
that just killed him, But at
Yes.
that point that it might be arguing or quarreling with someone, his blood pressure may be
Okay.
rising, going up, and then like I said, once pressure is high enough, it bursts the pipe. And so at that point, he falls down, He gets to the hospital, he
Okay.
dies, and then everybody thinks that his opponent killed him.
Using
You
juju.
know, so so those are the two differences, and it brings me to um, the next um, thing, which is okay. What are the? How would you tell if someone is having a stroke? Right?
Okay.
There's
Mm-hmm.
a very common mnemonic that we all use that everybody's a lot of people are familiar with, and that is the fast. Okay, face F, F is for face, A is for arm, S is for speech, and T is for time. Now, even some people even go as far as adding BE to it, like be fast. The B is for
Okay.
balance, because stroke could also affect balance and walking, depending on the part of the brain that gets involved. Then E, if eyes, if the person is having problems with their vision. So
Okay.
the general principle is that anything that causes a sudden, if something suddenly happens to anyone that is from that you suspect is from a brain problem, take the person needs help as soon as possible and it needs to be taken to the hospital. So
Okay.
let's go through it again. Be fast. B, any problem with balance
Okay.
or walking. E, any problems with your vision that happens suddenly. Then face. If there is a problem with your face in which a part of the face just deviates to one side, which we call a droop. And arm, if you feel weak in your arm, which happens suddenly. And then if you have any sudden speech problem, you
Okay.
need to act fast and take the person to the hospital to seek medical attention. Those are the basic ones that are most common. There are a lot of other manifestations, but it will be beyond the scope of our discussion here. Okay.
Okay. So thank you very much for that, sir.
Okay.
Yeah. So I was wanted to ask: these manifestations do they present when the person already has a stroke or before the stroke occurs?
So, as the person is having the stroke, those are the
Okay.
things you see. So, the brain, for a lot of functions in the brain, the right part of the big part of the brain supplies the left part, and vice versa.
Okay.
Now, all that you are seeing here in your head, if you just go below the skull, it's all brain. So the brain is all
Okay.
right under your skull, and they serve so many functions. And if there is a cut in blood supply, immediately that cut in blood supply occurs, the person will have symptoms immediately.
Okay.
Okay. Now,
Yes.
there are some, it also depends on how big the area is affected. There are some very tiny areas in the brain that could lose blood supply and you may never notice. The only way that we know that they've had a stroke is a few months or years later, and then for some reason they do a test of their brain and they see the signs of a stroke. So they could have had strokes in some certain areas that they never noticed.
Okay.
But if it is large enough, you get an immediate manifestation. In fact, there are some times that you don't get a large, I mean, there's a cut in blood supply, but it never totally gets cut off. So the part of the
Okay.
brain is still struggling to survive. It's still alive, it's still working, but is under stress. That is what we call transient ischemic attack, TIA.
Okay.
So that means the part of the brain just loses blood for a brief period, and then as it loses blood, you feel the symptom, but for some reason there's restoration of blood, or the blood takes another channel and still supplies that part of the brain. At that
Right.
point, that place is at risk, but it's back to its function. That's why even transient ischemic attack needs to be addressed as if you had a stroke.
Yeah, it's true. Yeah,
So I think I've sort of covered the manifestation of stroke, and then I've also
yes,
covered the transient ischemic attack.
yes, you have. Thank you very much for that, sir.
Okay.
Okay, moving on, I have another question. It's not okay. It's basically to bringing this home. Usually, once we have health talks like this or things like this, most people feel like these disease or these conditions are abstract. I feel like it's not, it does not affect us in this side of the world or something like that. When you just briefly touch on the prevalence of stroke in Africa, so people know that this thing is actually it's actually exists, it's actually in Africa, actually affects us as well.
All right. Okay. That's another good question. Um, so the thing is that the number of studies that try, generally doing a prevalence study can be very tedious and can be expensive over the years. But a few studies have been done in some parts of Africa, Nigeria inclusive, over the years. And then there were studies that, looked at the prevalence of stroke ranging from the 80s to the 90s. And it was found out that in some parts of Africa, the stroke can be prevalent, can have a low prevalence, and in some places it can be very high. It can be as low as 15 per 100,000 in some parts of Africa, but it can also be as high as 2,300 or 2,300 per 100,000. And so some studies just show that almost 1,000 people per 100,000 people. So for every 100,000 people, you can have up to 1,000 people.
Okay, so
Um,
that's like 40 cents.
yeah, you can have it that much. And
Oh,
you can it's every few seconds, in Africa somebody is having a stroke somewhere, you know so in at least one stroke per minute, you know and stroke is not a condition like malaria or typhoid or infection of your respiratory tract that you have it, you take antibiotics or you get better and you're well. It causes a significant amount of disability. And so in many parts of Africa, the interventions are not as quick as you would expect, that you would hope for. And so a lot of people have their disability over, that lasts their entire lifetime. So as people have a stroke, a lot of them just live with it. If they don't recover well, they'll live with their stroke till they die. You know, so
yes.
it's quite a common disease, and and it can affect anybody, whether you are rich, you're poor, um, no matter your status, man, woman, you can have a stroke. It tends to be more common in men,
Okay.
in the younger population. But as you start growing older, as you start growing above 50, the um, incidence, meaning that the number of people that have stroke starts equalizing between men and women.
Oh,
So,
okay.
so the older you are, the more likely you are to have a stroke, regardless of how well you take care of yourself. That's why you hardly see children have a stroke. If you're a man, you are more likely to have a stroke. If you have some conditions like high blood pressure,
Okay.
diabetes, high cholesterol, if you smoke cigarettes, if you take heavy alcohol, if you have any heart condition, you are at risk for a stroke. If you have any clotting disorder or any clotting disease, if you have a family that they seem to have some problems with blood clotting issues, it's worth checking out.
The next question would be: so you mentioned these risk factors. You've mentioned a lot, really, a lot to take. On individual's part, on each person's part, what can we do, or what can each person do to reduce the likelihood of them developing a stroke or them having a stroke?
Uh, by identifying, first of all, by thinking of the risk factors, of course, we can. These are the things I mentioned risk, are things that you can do something about. Now, there are some things you can't do something about.
Okay,
For, I sort of mentioned them, like when I said the older you are, the more likely you are to get a stroke.
to get a
You
stroke,
cannot
yes.
do anything about getting old. You cannot do anything about being a man compared to a woman. Okay?
Yes.
But the ones you can do something about, like the high blood pressure, the
Mhm.
diabetes, the high cholesterol, cigarette smoking, those are they are totally within your control. Um, my father used to say something. It's a Yoruba saying that if a train should hit a person, it is his ears that killed him. Meaning, there's no way that you should get hit by a train on if you because the train will keep making the
Loud
sound
noises.
choo 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 choo. So if you get hit by a train, you did not hear the sound. And so the warning signs. I mean, so it's basically what you have to do is just try to avoid the things that will cause you trouble from the beginning. So, and again, still having to borrow from Yoruba. So there's this another saying that say "Kobama see." Hey, I'm not sure if I said it well. In other words, it's just to avoid something happening.
Oh, okay.
So basically, if you one of the strongest risk factor is hypertension. And
Mhm.
for every time that your blood pressure goes, the normal blood pressure is less than 120/80. Okay?
Okay.
Even the lower, the better, as long as you don't have any dizziness. But for every time your blood pressure goes up by a certain amount of, by certain numbers, which I'll not bore you with, for every time it goes up, your risk of stroke doubles. You know, so
Yeah.
in other words, if your let me be more specific. If your normal blood pressure is 120/80, if your blood pressure starts going, if you check your blood pressure now and it is 140/90, oh, then that's what we're calling high blood pressure. If the
Yeah.
next time I check your blood pressure and it's 150 and it moved from 140 to 150, your risk for stroke doubles and
Wow.
it keeps doubling. So, in
Right.
other words, all you have to do is to even try and reduce your risk for stroke by half is take blood pressure medicine,
Oh, okay.
exercise, lose weight, take fruits, vegetables, things that can help keep your blood pressure normal. Those are some of the lifestyle things that you can do without even stressing yourself. So if your blood pressure starts going from 120 to 130, and you know that your weight, yeah, you are found to be obese, or that your weight is getting too much for your size, for your height,
Okay.
then it's time you start burning more energy. You start eating less, start eating more fruits and vegetables, start trying to lose weight, because if you lose weight, your blood pressure also improves. So eating well, fruits, vegetables, exercise, try to keep your blood pressure within the normal range. And if it keeps staying high, then you start taking medication. And the aim of the taking medication is to keep it below a certain level. Try to keep it below 120/80. Okay?
Okay.
That
Yes, sir.
alone. can reduce your risk of having a stroke, whether it is the wet stroke or the dry stroke.
Okay.
Then identify diabetes. So that's why it's good to get your medical checkup done, because part of the things they will do is check your urine for sugar and check your blood for sugar.
Yes.
Okay. If your sugar is high, then they do some other tests and find out if you have diabetes. If you have diabetes, then it is not a death sentence. It just means that you need to make adjustments again in your diet, and you also, depending on the value of your doctors find, you may also need to start medication as well. And going back to the weight loss, in people that are obese or people that
Yes.
are too overweight for their age, if they and their height, if they lose weight, it improves their glucose control as well. And then
Okay.
as part of your test for high blood pressure and diabetes, they will check um your cholesterol. And then if it's also high, it can also be addressed. If you smoke, stop smoking. If you never smoked in the past, do not smoke. Then back to what I said, um, check your hood while you still feel good. It is
Good.
what the chair of my department used to tell my patients, and I adopted it. It's good.
Okay.
Check your hood while you feel good. Just check. It does not hurt. It does not cost a lot. Just go get yourself checked out. Let someone examine you. Let your doctor examine you and do some basic hip tests. Check your urine, check your blood, check your blood pressure, check your weight, your height, and calculate what we call body mass index. See if you are normal weight, overweight, and get the advice. All this is to prevent a very expensive disease, a very disabling disease. Yeah.
Oh, okay. Thank you very much for that, sir. Thank you for like you've touched on every important thing, and
The
there
only thing
is
I did not mention that much is treatment, because, I mean, once it gets to treatment, I mean, first of all, just seek help. And when you get to the hospital, there are things that can be done. If you come within a certain period of time, in some parts of the world, if they have the appropriate medication, if you come within a certain time, within 3.5 hours of stroke, they can actually give you some injection that can help to burst the clot. If it's the dry stroke, if there's a clot in your brain, it can help to burst the clot and improve
okay.
your disability over time. And then there are some other things we have to do once the person comes to the hospital to try to reduce the damage. But if you're in the hospital, the damage has been done already. We're just going to try to avoid further complications and try and get
Okay.
you back to yourself as much as you can.
Okay. Thank you very much for that, sir. So, as much as I'd like to continue asking the questions, with time is fast spent. So, any last words for our audience and take-home message on stroke?
Uh, well, the thing is, stroke is preventable to an extent. There are some things you can do to reduce your risk. Um, or whatever is within your power to do, you can as well try to do it. Reduce your risk by checking yourself, and controlling the risk factors that I mentioned there.
So, guys, we've gotten to the end of today's episode, and that's all the free consultation you'll be getting. If you still have questions, you can drop them in the comment sections, and we'll be sure to treat them. Thank you for sticking by, and I hope you've been able to get a basic education on what stroke is, the causes, and how you can reduce your probability of getting it. And don't forget, let me borrow Dr. Lawal's phrase.
Check your hood while you still feel
Check
good.
your hood while you still feel good. Yes, check your hood while you still feel good. Okay, so that's the end of the show for today, guys. Don't forget to like, subscribe, and turn on post notifications so you get informed the next time we go live. And in the meantime, if you're trying to navigate the entrepreneurial space or you're simply curious as to what makes successful people take. You can head to our YouTube channel page to watch our Amazons and Afripreneur series. See you again next time, guys. Cheers.